the NHS is beginning 2024 the same way it ended 2022, on strike. This week's industrial action by junior doctors is the longest strike in the history of the NHS at the worst possible time, because even before the strikes this week, the NHS was struggling to stay afloat this winter. Hospitals were declaring critical incidents before the strikes. Patients were waiting dangerously long for ambulances and in A&E before the strikes. Ambulances were queuing up outside hospitals for hours to hand over patients before the strikes. The truth is, before the strikes and before the pandemic, the NHS has been facing winter crisis after winter crisis as a direct result of the Conservatives' failure. Their failure to train enough staff, their failure to arm the health service with modern technology, and their failure to reform. In January last year, the Prime Minister published an urgent and emergency care recovery plan, promising, and I quote, the largest and fastest improvement in emergency waiting times in the NHS's history. Instead, heart attack and stroke victims are waiting even longer for an ambulance, and A&E waiting times are the worst they've been all year. The Prime Minister promised 800 more ambulances, but the government has now admitted they are just replacing existing ambulances. He promised 50,000 patients a month would be treated in virtual wards, but in reality it's fewer than 8,000 patients. Isn't the truth that the Conservatives once again sent the NHS naked into the winter and patients are paying the price? Given how ill-equipped they left the NHS, and given the desperate pleas from NHS leaders for these strikes to be resolved, why on earth did the government choose to sit back and let this damaging strike action go ahead?
That's right.
Not only did the Health Secretary allow talks with the junior doctors to collapse, not only did she refuse to reopen negotiations until tomorrow, when the damage will have been done, at the 11th hour, as junior doctors stood on the edge of this strike action, she chose to push them straight into it. In what way was it helpful for the Secretary of State in a series of broadcast interviews to patronise junior doctors by rebranding them as doctors in training?
That's right.
A junior doctor can have 10 years' experience under their belts. They do not expect to be trolled by ministers who have been in office for barely 10 minutes. In his interview on the BBC yesterday, we saw why the Prime Minister has allowed these strikes to go on for so long without intervening himself. He is using industrial action as an excuse for the state his party has left the NHS in after 14 years. And he would rather blame NHS doctors and nurses than take a shred of responsibility himself. Meanwhile, patients can't get an appointment, can't get the surgery they need, can't see a GP, NHS dentistry is decaying, and the NHS itself is on life support. And while the Prime Minister was bragging about all the parts of the NHS that aren't currently on strike, because that's how low he now sets the bar, he seemed to have forgotten that nurses are still in formal dispute. Is he so uninterested in our nation's health service that he didn't know? Was he trying to pull the wool over the voters' eyes, or is he just another Tory Prime Minister asleep at the wheel as he drives the country off a cliff? There was one thing the Prime Minister got right in his interview with Laura Kuenssberg yesterday. Whether the question was on the NHS, immigration or the economy, his response was the same. Ask the Leader of the Opposition. It seems even this Conservative Prime Minister knows that if you want serious solutions to the problems facing the country today, there is only one place to look, and that's the Labour Party. Patients are sick and tired of waiting. Waiting for ambulances, waiting for a GP appointment.
Order! The honourable gentleman has been here long enough to know that people do not give way during a statement. Wes Streeting.
Thank you, Mr. Deputy Speaker. Patients are sick and tired of waiting. Waiting for ambulances, waiting for a GP appointment, waiting for their operation, and waiting for a general election that can't come soon enough. Why don't they get out of the way and let Labour fix the mess they've made?
Secretary of State.
Well, Mr Deputy Speaker, may I welcome the honourable gentleman back from his world tour promoting his book. It's very nice to meet him for the first time across the dispatch box. Whilst he was away in sunnier climes, he may have missed what is actually happening in Wales, which interestingly has been described by the Leader of the Opposition as the blueprint for how Labour will run if they were ever to come into government. Interestingly, in Labour-run Welsh the Welsh NHS, people are almost twice as likely to be waiting for treatment. And they are waiting an average of 5 weeks longer for NHS treatment under Labour in Wales than they do in England. And indeed, the number of patients in Wales seeking treatment in England has increased by 40% in 2 years because of the experiences they're having in Wales. But I'm just going to correct him on a couple of other things as well, just to help him understand the 800 new ambulances. Those are new ambulances. We are delivering them at pace. That is at the request of the NHS. And as is indeed the 5,000 extra beds that we are putting in across hospitals across England, because we understand the point about capacity and we want to help the NHS look after people in a timely and efficient manner. I'll just again also correct him on the doctors in training point, and I'm surprised he's come into it at this point. Had he spoken to his friends in the BMA, he'd have understood that that phrase is the phrase that the BMA are using themselves, because they have passed a motion to stop using the phrase junior doctors. And the honourable gentleman, the BMA passed a motion. And the honourable gentleman says refer to doctors. Again, he perhaps doesn't understand the complexities of contractual negotiations. This phrasing is used in order to denote those professionals who are still on formal training pathways, who are not specialty doctors, who are not consultants. This is the terminology that has been agreed with the BMA. But in terms of the strikes themselves, I note, and indeed I know that those behind me noted as well, the honourable gentleman didn't actually condemn the strikes. I'm very happy to give way if he'd like to confirm whether he condemns the strikes. Unfortunately, he's missed his chance to do so, but I suspect everybody, the patients at home waiting for appointments, will see the Labour shadow minister's failure to condemn these strikes, and that is because, Mr Deputy Speaker, in line with the public sector strikes more generally, the Labour movement will always prioritise union harmony over patient safety. That is not what we as Conservatives do. We will always put patient safety first.